So we'll continue today our discussion about environmental inputs, and today we'll talk about the water intake. So our body is actually 70% water. So it's very important, and we really cannot survive without appropriate water intake for over a week. When I see my patients in clinic, I very commonly will ask them how much water they drink, and most of them will say, "Oh, I drink plenty of water. That's not a problem." And when we actually get into discussion of how much water they drink, they realize that they drink about half of what they're supposed to consume. So how does water affect us, and why dehydration potentially can cause a stroke? Well, just let's think about it. So strokes do not happen just because they happened. Something in the body was not working properly, and then all of a sudden the compensation was not there, or something else happened on top of things, and then patient develop a stroke. That's why it happens all of a sudden. But in reality, there was something else going on in the body a long time prior to developing strokes. For example, patients commonly will have a little plaque in the carotid arteries, and that plaque typically does not completely prevent blood flow from floating there. But then all of a sudden, patient became dehydrated, and then the blood become a little bit thicker. And then all of a sudden the flow is much slower, and then the clot forms, and then patient develop a stroke. That is much more common in patients with diabetes whose very small vessels are affected by those plaques, just because of the sheer size of the vessel and sheer kind of narrowing of this particular channel. The same happens in younger patients when they have thicker blood, or they have oral contraceptives on board. Then again, they will get dehydrated, the blood will get thicker, and then all of a sudden they form a clot, and then all of a sudden they have a stroke in a younger age. So how do we prevent it? Well, should we become a gallon-carrying people who on the internet claim that they drank a gallon of distilled water and very happy about it? Absolutely not. We will potentially damage our body if we drink inappropriately too much water or inappropriately too little water. Like everything else in the world, water can be bad or can be very, very good. So if you'll drink too much water, you actually will dilute significantly your electrolytes, and people have died because of that. So absolutely, I don't advise people to drink gallons and gallons of water, especially distilled water. The typical recommendation that I give to my patients is to drink about half of the weight or half of their weight in ounces. So for 200 pound person, you need to drink about 90 to 100 ounces of water a day. What does it look like? Well, typically I tell my patients to drink at least 24 ounces of water in the morning when they wake up. Why do I say that? Well, think about it. We don't like to drink a lot of water prior to going to bed, because otherwise we'll have a lot of breaks at night and go into the bathroom. So by the morning, we kind of wake up already dehydrated. That is actually one of the reasons why there is a lot of strokes that happen at night or early in the morning, because we are dehydrated. And that is actually one of the biggest reasons why I give my patients a lot of fluids when they come to see me in emergency room with a stroke. So this is exactly the reason for that. So what we need to start thinking about is to really preloading ourselves with water. So 24 ounces early in the morning, kind of in the first half an hour after waking up. And then the rest of it will be kind of given or taken rather throughout the day. So, and then it not becoming a very big chore. But I also advise patients to really measure their water intake. So get a big bottle, like 64 ounces bottle, and just see how actually much water you drink, because you will be surprised that you'll realize that you drink very little water, and then really you increasing your chances of some unfortunate problems in future. So let's drink plenty of water. Let's also start thinking about the quality of the water as well. Is all water really great for us? Absolutely not. Tap water in vast majority of the municipal areas is absolutely horrible. It has a lot of toxins. It has a lot of sort of residuals from medications, from oral contraceptives, even from drugs. So we certainly want to be very careful about what kind of water we drink. There is a website, it's called ewg.org, and there is a tap water database. You can actually look up your quality of water and just see how bad it is. So there are also a lot of filters that you can buy, and vast majority of, unfortunately, of them are not very high quality filters. They remove the dirt and they remove some bigger molecules, but they're not going to remove a lot of harmful molecules. So for that reason, I recommend for vast majority of the patients to really consider drinking either mineralized reverse osmosis water or high quality bottled water, more commonly than not stored in a glass bottles than in the plastic bottles. There are some other filters that potentially can replace reverse osmosis water, but we kind of discuss that with patients on an individual basis. If you like this video, please subscribe to my channel, and again, put a like to that video so more people will find those videos, and hopefully they'll be also as helpful as they are for you. Thank you.